This is Aaron Holly at Orthopedic Rehab Specialist.
How would you say is a good way to promote exercise as medicine now that you know, like, it's basically just about promoting, exercise as a beneficial standpoint for health and other things of that nature?
Yeah, again, it's something, as a physical therapist, it's something I promote to my patients every day. A big piece of my spiel with my patients, well, even from the first day they come in, I'm already planting seeds for how I'm going to get them to try to buy into a more fitness-forward lifestyle.
Okay.
Very first day when a patient walks out of physical therapy, of course, we talk about their specific injury that they came in for and what their goals are for that. But we always talk about fitness and activity and overall health and wellness as being a piece. So we promote within orthopedic rehab what's called the 4 pillars of health and wellness, and it's basically the importance of taking care of nutrition, activity, stress management, and getting good quality sleep and rest in their overall health and wellness. So we sprinkle that in from day one. So we talk to them, give them a handout. It's actually in the handouts we give them on day one of physical therapy that talks about those in a very kind of short, brief version just to get them thinking about it.
Okay.
And then as we're progressing them through things in therapy, as they start getting well, as their pain starts to calm down, we definitely get into more fitness-forward activities, try to get them in habits that are more similar to what it might be at a gym. And every patient that I see, when I'm done with them, we talk about what's your plan for fitness moving forward. Is it just simply going to be a good walking program that you can do at home in addition to some of the strengthening things that you've learned in PT? Are you going to get a gym membership? Are you going to continue with us in what we call our aftercare program, where you can come in basically like a gym membership and just use our equipment and carry on that way? Or here we also have a performance training aspect of our company where if you're more interested in more higher level group fitness type activities, get some more direction, we have those available. So I always present them to patients from the beginning. And certainly we'll use the analogy of, exercise is the best medicine. I was telling a patient yesterday that in this discussion I was having as he left, that if you Google any medical condition pretty much in the world, I challenge you to find one that in the guidelines and recommendations for management of that condition, it doesn't include some form of exercise.
Oh,
so
yeah.
I think it's well known and well accepted within the medical community that wellness prevention is the best way. If you don't have time for wellness, you're going to make time for illness.
For sure.
That's a great answer. Basically we're learning that anywhere from diabetes to hypertension to anxiety can be cured by exercise. So that is really cool that you know all that. I don't know if all health professionals do as good of a job of promoting exercise as a modality. I know physical therapy, it's directly exercise that's causing the improvement, but
as that's what we do every day, as we are the movement experts. But I think the medical community in general is coming around. I still think that we get specialized into our own areas. So a surgeon's going to be ultimately thinking, can I help them through surgery?
Right.
Somebody who is, somebody who's more of a holistic medicine type person, they're gonna try to figure out natural ways to help somebody with their health. And I think people are starting to think of the 4 pillars aspect. They're starting to think of physical therapy more. Like physical therapy as a profession or as a service is probably in more demand now than it's ever been. And I think a big piece of that is the younger physicians and things that are coming out and getting a lot more education on the importance of supplementing what they do with PT as a nice link to fitness and a nice link to activity. So.
Yeah, that's awesome.
It's awesome. I know ORS has the ORS race series. Do you think you could talk a little bit about that? Its goal, what it was trying to accomplish, that kind of thing?
Yeah.
When it started?
So actually the race series is something that has been going on in the Jackson area for years. Well predates my tenure with orthopedic rehab. It used to be run by a local newspaper called the Citizen Patriot, so it was called the Sit-Pat series, and for a while it was really big in the running boom in the 80s, 70s and 80s and on, I think. At some point, that newspaper ceased to exist, and somebody needed to take over the race series in the community. So we supported that from there on out, took over the title sponsorship of that because we knew it was an important community thing to promote fitness. And obviously it's a big part of what we are about as community and promoting fitness and wellness. So it made sense for us to take that over. In the early years, I think it was more that we paid a sponsorship and we got the title sponsor, but we didn't get super involved in the organization of the event. Kind of individual race directors just kind of did their own thing, and we put our name on the series. And I would go to some of the races and realized that we could be doing a lot more. We could be having more of a presence. We could be using it as a platform to promote fitness and drawing community get together. So when we actually hired a marketing person that could put some time into that, they really started to take it to the next level and really getting a good coordination between all the race directors to try to make it a bigger thing, and it's really, really grown. Obviously, COVID was a hit, but we got to the point now where we have a very big presence. You go to the races, and our name's all over the start-finish line. We always have a table there and people there to talk to participants, things that tie everything together, and awards for those who are consistent and attend all the races, and kids race for future of fitness and wellness and all that stuff.
That's what I was going to mention. I really like how like almost every race you have a kids race, which is really fun because maybe a kid won't want to run a 6K or a 5K or a 10K, but like the 1 mile mighty run, that's a pretty cool event.
That is awesome.
It's really cool.
That is actually a requirement to be in our race. You have to offer a kids race, and so part of that reason is just simply we want to promote that family fitness and that fun family atmosphere, and again, it's planting the seeds, getting those kids seeing people out doing healthy things, and they soak it in. They might not realize it, but you tend those things. They earn little tokens when they finish races, and they try to collect them all from each race for consistency. So it's trying to promote that consistency of activity and stuff with them as well.
Make exercise fun from the start.
It
doesn't have to be a drag.
100%.
That kind of links into something else I wanted to talk to you about the concept of everything counts. Have you ever heard of that principle at all?
Not necessarily specifically said that way, but
so anything from like gardening to mowing the lawn to just going on a walk with your kids, it doesn't have to be a structured exercise every time. Like little things that can count as exercise that people don't usually think of as exercise.
Activity matters. And there's a balance of that too, because I think you also have to be careful. You want to support people that anything that gets them moving, right, is good, and you want to meet people where they're at and just get them off the couch, get them out of the house, anything to get them moving outside and getting some vitamin D. But at the same time, if people, depending on people's fitness goals, if they truly have goals to get more fit and get stronger too, I think you also have to be comfortable having the conversation of the difference between activity and intentional exercise to get your heart rate up if your goal is cardiovascular benefit. Your benefit of progressive loading if your goal is to be stronger, get stronger bones, so yes, I agree everything matters, and any activity is good activity versus a sedentary lifestyle. But at the same time, it's okay to challenge people to think a little bigger too, and be a little more intentional with their exercise.
I think ORS does a great job of continuing treatment even after like the 8 weeks or whatever their prescription ends, of offering aftercare, of offering performance if they wanted to work with Nick. I think that's great to just continue the goal.
Definitely be able to provide them options, and I always say while they're in the habit. If they're coming into PT 2 or 3 days a week and they've created a habit of fitness, a habit of going out and doing something, to continue on with it at that moment, create good habits. It's a nice time for them to transition to, gosh, I feel really good since I've been starting to be more active. Well, great, let's keep that going. Let's give you some options for what that could look like. And some people like a group fitness setting. Some people like to just go do something by themselves and get out for a walk. Some people like to exercise at home. Some people like to go to the gym. I always say find something you enjoy. A lot of times people ask, well, I don't know where to start. And my answer usually is just find a routine of, if it's a gym membership that you have and you want to use it, just go. I don't care what you do when you get there. Just go to the gym 3 days a week. When you first get there, you might do very little and you might be a little uncomfortable. You find a machine or two you want to try out. You do it again, and then you do it again, and you do it again. And naturally, you're going to get in the habit of going. Naturally, you're going to start doing a little bit more. You're going to start getting a little more comfortable in the gym every time you go. And you'll create the habit first. And then once you create the habit and you get kind of that baseline of getting used to it being part of your lifestyle, then let's take it to the next level and talk about, can we design something more specific, to really intentionally work on getting you to the next level. But
Gotcha.
you just got to start and create the habit. That's where I usually tell people that start there and you can't go wrong.
Awesome.
But how would you go about, working with someone that you can't really teach them how to do something because they are just so physically fit?
So I deal with people all the time who are way more physically fit and capable than I am.
Okay.
And that doesn't stop you from having a benefit to those. I mean, because your knowledge is here. Just because you can't put your leg behind your head and they can, doesn't mean you can't work with them. I think you have to have an appreciation for differences and unique abilities of. I can't run like this guy can. You probably are a runner too.
Oh yeah, I can't run like this guy either.
But that doesn't preclude me from being able to help give him some suggestions or give him some things to think about in his training.